How's it going, everyone? I hope you enjoyed that little Spider-Man sequence I put together for you. A month ago, I went through vision correction surgery, TransPRK to be exact, in Advanced Vision Eye Specialist Center in KL, and I wanted to share my experience with you. Disclaimer, this is not a sponsored video, how I wish. I just wanted to share my experience with you guys in case it could help even one person out there. Okay, so first off, here are the subtopics I'm going to be talking about, and here are the timestamps to each of the subtopics. So we will start with number 1, which is eligibility and costs. So who can actually get this surgery and how much will it cost? So generally anyone aged 21 and above with a stable prescription is eligible for this surgery. You will have to go through a screening process to determine whether your eyes are healthy enough, and they will check your glasses and compare it to your current prescription to determine whether or not your prescription is currently stable. So for the important part, the cost, of course, this surgery is actually quite cheap in my opinion. Pricing depends on 2 factors, one being prescription power and number 2 being your corneal thickness. So if your myopic power and also your astigmatism amounts to a number which is more than 400, then you will have to take a more expensive surgery, which is the 5,588 ringgit one, plus 100 ringgit for the doctor consultation fees. And the same goes for people with thinner corneas. On the other hand, if your prescription and astigmatism is less than 400, so for example my prescription power was 3.5 and I had an astigmatism of 0.25, so that was 3.75, so I could opt for the cheaper surgery, which costed 2,988 plus 100 ringgit for the doctor's consultation fee, and this is provided your cornea is actually thick enough. So these prices are for both eyes and not per eye, because I get a lot of this question. Okay, so now for the procedures. The first step you have to go through is an eye screening. So you'll make an appointment with them. They'll tell you to come at 9 a.m. because that's when the doors open, and maybe you can arrive a little bit earlier than that because by the time the doors open there'll already be a queue of maybe 10 people before you. So you go in, you give them your IC, they'll give you a health form to fill out, and then you give it back to them, and then they'll ask you to sit down until your name is called. So they will first do normal tests, like when you go to buy glasses, and afterwards they will put eye dilating eye drops into your eye and you will see the doctor for further examination. So what I remember is the 2 tests that the doctor did on me. So the first one is you put your head onto the machine and then a gust of air will be blown into your eye.
1, 2, 3.
And the second one is for you to stay into a bright light while the doctor examines your eye. This is not entirely comfortable as your eyes will be very sensitive to light due to the eye drops, and this may last around 3 to 4 hours, so you may want to bring your sunglasses for this first day. So if you are cleared for surgery, you'll be asked to pay the full amount or opt for installments. They will also ask you to take a COVID PCR test within 2 days of your surgery. So take note, it's 2 days before your surgery. I had to take 2 tests because there was some miscommunication. They told me I had to take a test before the screening, and I did. And then when I came for the screening, they said, oh, the test is before the surgery, not the screening. So yeah, I wasted money and time, so just make sure that doesn't happen to you. Okay, so moving on to the surgeries. They only do surgeries on Fridays and you will need someone to take you home. You will be asked to come in at 8:30 a.m. and fill out some consent forms. Then the first patient will be brought up to the operating theater around 9. So they will bring patients up in groups of 3, and depending on how many people there are in front of you, you may be waiting around 40 minutes to 1 hour. So once they bring you upstairs, you'll be seated in the waiting room with 2 other patients, and right before it's your turn, they will bring you to a separate place, drop some eye numbing drops into your eye, and then bring you into the operating theater. So you'll be able to watch the person before you go through their surgery because they want to show you that it's not dangerous or it's not scary. And then they'll ask the previous person to tell you, oh, it's fine, don't worry about it. And it really is. So once it's your turn, you have to lie down on the operating table. The doctor will clamp your eyes open with that eye clampy thing. Then he will douse your eyes with water and clean them. Kind of like your eyes being waterboarded, but it's fine, your eyes are numb anyway. Okay, so now it's time for the actual laser. So you will be asked to look straight into a green light and to not move. So at this point, all you need to do is look at the light and just relax. You won't feel a thing, it's not painful at all. The only indicator that the machine is on is the whirring sound, and also the smell of burning plastic, which is actually your eyeballs. So what was really cool that I noticed was that initially when I stared into the green light, it was blurry, as all things are, and then as the time went on, I slowly could see the individual strands of the laser. It's like it was coming into focus. So at that point I knew that the surgery was working and that I will actually be able to see. And it only took around 10 seconds for each eye. You may take longer depending on your degree. Mine was 350. Okay, so once that's all done with both eyes, a bandaged contact lens will be placed in your eye, and the doctor will ask you to read a sign on his door and tell you what percentage of vision you have. So for me it was 60%, and he will ask you to reassure the next person, telling him that it's fine, don't need to worry, and then you can go home. You are given some medicine to cope with your surgery. So one antibacterial eye drop that you have to use for 5 times a day for 2 weeks, one anti-inflammatory eye drop, also same, 5 times a day for 2 weeks, and one normal eye drop just to lubricate your eyes in case they're feeling dry, and one eye ointment, a sort of gel that you actually have to put on your eye before you sleep, and you have to use that for 5 weeks. Other than that, you will be wearing eye shields for 5 days, and they will give you sleeping pills, anti-nausea to help you get through the first few days of your surgery. And now this is where the pain starts. So when I got home, I started tearing up non-stop, and it was accompanied by blocked nose, so it was kind of like I was crying for no reason at all. So definitely prepare some wiping equipment for the whole day, because it lasted me the whole day. So around 3 hours after the surgery, the effects really started to hit me, and I started feeling a big pressure on both my eyes, and no matter if I closed them or if I opened them, it would still hurt. So I took the painkillers and it helped by dampening the pain a little bit, but it was still painful. At night I took the sleeping medicine they gave me and tried to sleep, but I just couldn't because the pain was too bad. I may have only gotten around 2 hours of sleep that night. So on day 2, the tears have stopped flowing. I went to the clinic for my post-operation checkup, and when I was there, everyone was telling me it would be better on the 3rd day. I went back home and I had a mild headache for the rest of the day. I was just counting down the hours until it was the 3rd day because I just wanted the pain to stop. So at night, I took the sleeping pills again, and this time it actually worked, but this time, I think I probably had some kind of sleeping pill induced hallucination, so that was pretty fun. Okay, on day 3, the pain was completely gone. My eyes were just a little bit uncomfortable because it felt like there were grains of sand in my eye, but compared to the first 2 days, this was pretty much nothing. I could finally look at my phone and actually reply messages that people sent me, but I don't recommend doing this for too long because it was very straining for my eyes. So on day 4, there was no discomfort. I could see around 60%, but my eyes were getting tired from wearing the bandaged contact lenses. Okay, so day 5, went to the clinic to get the contact lenses removed, and when it was removed, I still felt like my eyes were pretty dry. There were like grains of sand in my eye, so I was a bit worried, but it went away after a few hours. My vision was around the same. Day 6, felt normal. My vision was around 50%. Okay, on day 7, my vision was quite good. I was able to see my sister get married and attend her wedding that night, and I even managed to take photos of things happening around me. For 1 week in, my vision was okay and my eyes were definitely functional. Okay, so week 2, I had my mandatory follow-up with the doctor and she said everything was fine. My vision became worse, around 50%, but the doctor said it was normal for vision to fluctuate in the 2nd week and things will be stabilized in the 3rd week. So in week 3, as the doctor said, my vision did indeed stabilize. It got better and I was able to see around 70%. I had less double vision around objects compared to before, and there was some slight haziness, but apparently that's to be expected. I could watch TV and everything was in focus, but to read the subtitles were just a bit taxing for me. And I noticed that in every day towards nighttime, my eyes became much worse. It was probably because my eyes were getting tired, straining the whole day trying to focus on things when they are actually still recovering. So do keep that in mind. Okay, so in week 4, for the first few days, my vision was slightly hazy, but it got better. And I would say my vision is around 70% so far. And I can do normal tasks around the house with no issue. And I'm just waiting for my eyes to have that very full HD vision that I hear some people actually have. Okay, so now on to some tips. Okay, number 1. Bring your sunglasses to the first appointment. It's not mandatory, but it will probably help you. Number 2, be patient. There's probably a lot of waiting in between appointments, and it's usually quite pointless, but just bring in some headphones, listen to some music, and you'll get through it no problem. Number 3, prepare some audio entertainment for your first few days, something like audiobooks or podcasts, something that you don't have to look at a screen in order to enjoy. Okay, number 4, make some friends from your surgery. When I was in the waiting room waiting for my turn, I was talking to the people beside me and I hit it off with one guy. It's really useful when your vision gets worse and you're quite worried, so it helps to ask someone who went through the exact same thing as you and realize that you're going through the exact same thing. So it's reassuring knowing that, oh, you didn't do anything wrong, it's fine, and that this is just a part of the process. Okay, number 5, have someone drive you back from the surgery. They will mention this to you, but just remember it because it will be a bit hard for you to navigate outside after the numbing drops wear off. Okay, and lastly, tip number 6, don't be afraid and just relax. If you go to the clinic and you sit down and you look at everyone around you wearing sunglasses, those are people who have actually gone through the surgery and they're fine. They're there for their next checkup. So chances are you will also be fine. So just relax and do everything the doctor says. So, should you actually get the surgery? If you're tired of wearing glasses and contact lenses, and you're willing to go through the 2 days of severe discomfort and also the 6 months of not so perfect vision, and you have the money, I'd say go for it. You may think 3,000 or 5,000 is kind of steep price, but in the long run, if your surgery lasts you for 20-30 years, you don't have to buy glasses or contact lens solutions anymore, then you would definitely get all that money back and then some. It takes 6 months for your vision to be fully stabilized, and you would have to wear sunglasses for those full 6 months if you ever go outside in the sun, but your vision will be quite usable after 3 or 4 weeks. And after those 6 months, you don't have to worry about your vision ever again. So for me, I really appreciate being able to see without glasses. My glasses no longer fog up when I get out of a car. I can finally see myself in a bathroom mirror. They no longer fall off when I work out. And I think generally I just look better without glasses. Also, I think the surgery comes at quite a good time because my glasses are pretty much falling apart. Okay, so this is the end of the video. Thank you for watching. I hope this helps you in some way, whether it be making up your mind about taking surgery or just telling you what you need to know about it. If you have any questions, just ask them in the comments. I promise I will answer every single one. And until next time, I'll see you guys.